Alright, gang. On this one, I'm going to actually turn it over to another video here, but it's the 2005 PALS video, but it has, I think, an extremely good assessment video on it, and we're going to go over some things involved in that. So, with no further ado, let's get that started here.
This is a sequence known as assess, categorize, decide, and act. During assessment, the cyclic process proceeds this way. As you assess a child, you need to categorize any illness as either respiratory, circulatory, or a combination of both. Also categorize the severity of the condition. Respiratory problems are categorized into 4 groups: upper airway obstruction, lower airway obstruction, lung tissue disease, and disordered control of breathing.
Okay, so understand that these are one of the 4 silos that we want to put a respiratory problem in. That's very important to understand. And it's very important to understand the difference between this right here.
The severity of a respiratory problem may be respiratory distress or respiratory failure.
So again, respiratory distress, they're still working to breathe. Respiratory failure, they have ineffective breathing. It is not meeting the body's demands. And the basic way to tell the difference there is they've lost effort in breathing.
Circulatory problems can be caused by arrhythmias or shock. Shock is further categorized into 4 groups: hypovolemic, obstructive, distributive septic, and cardiogenic. The severity of shock may be compensated or hypotensive.
So it's very, also, when we're talking about severity, don't confuse the actual case with severity. Severity is how bad the patient is right now. And the difference between compensated and decompensated shock would be your blood pressure, okay? Which we all know is a very late sign if it loses that in pediatric patients.
Remember that as a critically ill or injured child may deteriorate, one category of problems may lead to others. Based on your assessment and categorization of the type and severity of illness, decide what needs to be done. Your decision should be dictated by your scope of practice. When you do act based on your decision, actions may range from providing basic life support to specific advanced life support interventions. Remember, throughout pediatric assessment, always look for any life-threatening conditions, whether you're just walking through the door or doing the tertiary assessment. If a life-threatening condition is recognized at any time, immediately begin life-saving interventions and activate the emergency response system.
Okay, so again, if you find a life threat, air's not going in and out, blood's not going round and round, you need to focus on those immediately as you find them. Okay, very, very important concept. You don't have to wait to give oxygen. You don't have to wait to start CPR. Do those things when you find the problem.
This cyclic process of assess, categorize, decide, and act is a continuous one. You will repeat these steps throughout every stage of assessment. Keeping this cycle in mind, you're ready to start the pediatric assessment model, which begins with the general assessment. The Pediatric Assessment Triangle, or PAT, is a reminder to evaluate the child's appearance, work of breathing, and circulation. This is the first and most basic assessment performed in the initial few seconds of patient encounter. It is a rapid visual and auditory assessment of the child's appearance, work of breathing, and circulation.
Hi, I understand you're Katie, and you're Mrs. Smith. I'm going to be doing a few assessments on you today.
The general assessment is your very first impression. What you see and hear when you first encounter the child before you even touch her. How does she look? Is her color good? Does the child interact? Listen for labored breathing. Is the child breathing normally? And if not, what is different about the breathing? Are there any obvious outward signs of circulatory problems? Any change in skin color or bleeding? Basically, in the general assessment, you evaluate the child quickly for any obvious life-threatening conditions. If now, or any time during your assessment, you find that the child has a life-threatening condition, you should immediately begin resuscitation or other appropriate interventions and activate the emergency response system. If there's no life threat, continue on to the next step, the primary assessment. The primary assessment, or ABCDE assessment, consists of an actual hands-on evaluation of the child. ABCDE stands for airway, breathing, circulation, disability, and exposure. The primary assessment is comprised of a physical exam, focused on assessing the ABCDE components and obtaining vital signs, including pulse oximetry if available. During the primary assessment, you assess the child's airway, breathing, and circulation, as well as disability or neurological status. You also make sure the child is exposed as appropriate to identify obvious life-threatening problems, such as external bleeding. The primary assessment is designed to prioritize treatment based on the physical evaluation of cardiopulmonary and neurologic functions, as well as the child's vital signs and oxygen saturation. Following the primary assessment, you should categorize the patient's condition, decide what actions, if any, need to be started at this time, and implement these actions as appropriate. If a life-threatening condition is found during the primary or any phase of the assessment, you should initiate resuscitation immediately and activate the emergency response system. But if there's no life threat, you may continue to the next steps, the secondary and tertiary assessments. The secondary assessment consists of two components. The first component is a focused history, which can easily be remembered by using the mnemonic SAMPLE, which stands for signs and symptoms, allergies, medications, past medical history, last meal or liquids consumed, and events leading to the presentation.
All right, Katie, I'm done with your assessment.
Okay. Hi, I'm Dr. Lana.
The second component is a thorough head-to-toe physical examination.
Just want to...
One goal of the secondary assessment history, or sample history, is to identify important aspects of the child's history and presenting complaint, especially any information that might help explain the child's presenting problem. The thoroughness of the physical examination is based on the patient's presenting symptoms and history. At times, a complete head-to-toe examination may be deferred until serious conditions are adequately treated, or to avoid excessively agitating a child with upper airway obstruction, for example. The tertiary assessment uses ancillary studies to identify problems and guide treatment. This assessment includes both laboratory studies as well as non-laboratory studies, such as X-rays or an ECG. It's important to initiate tertiary assessment anytime when assessing and managing sick children. Remember, it's important to be ready to initiate resuscitation or call for help if necessary anytime when assessing and managing sick children. When this happens, immediately start life-saving treatment. The key is to always adhere to a systematic approach and to continuously assess, categorize, decide, and act. This concludes.
All right, yay, this concludes the video, but I will tell you guys, if you use that approach, and I will tell you what we're really looking for. The first thing that we're looking for, when you get through with that ABC, the pediatric assessment triangle, you should be able to tell us whether the kid is sick or not sick, okay? And again, if any one of those things are negative, any one of those things pop up, if they don't look good, they don't sound good, they're working to breathe, that would be a situation where you would call this a sick kid and begin resuscitative measures, oxygen, possibly bag valve mask. So all those things, that's what we're looking for. And then if you do the ABCDE assessment, and by the way, I'm going to throw an F on there. The F is find the Broslow tape, okay? And the reason is because if you're not using it yet, you're probably going to use it in PALS, okay? Know if you're dealing with a kid, you need to have that length-based tape handy, okay? Unless you've memorized every freaking dose and can perfectly recite them every time. Point is that no, find the Broslow tape, all right? But if you do that A, B, C, D, E, we should be able at that point to know whether I've got a respiratory case or a shock case, okay? And by the time we finish our secondary exam, which is the head to toe and a good thorough history, we should be able to tell whether this case is a respiratory case or a shock case, okay? That's what we're looking for when we're doing the assessments, and that's what we want you to kind of focus on. Now, I understand that this was done for PALS, but this very much applies to any pediatric patient, not in PALS, but this is the way you should be assessing that pediatric patient. All right, guys, that's enough for today, and I'll see you on the next one.